Hello, everyone. My name is Deontay Gibbs, and today I'll be going over my abstract for my article examining perceptions about mental health care and help seeking among rural African American families of adolescents. And my article was written by Ms. Velma Murray, Craig Hefflinger, Sarah Suter. So, just a little introduction to my article and why I chose this topic. Mental health disparities among African Americans that intrigues me as communities of color or any other minority population seek and health care. So, pretty much what the author said in the article is that um, they observe that studies of mental health help seeking behavior among African Americans are extremely rare. And the related keywords include adolescence, youth, family, help seeking, mental health, and rural. Sentences reads in my article is that rural African American children living in poverty have a higher prevalence rate of mental health disorders than their urban counterparts. The mental health system has not kept pace with the needs of racial and ethnic minority Americans, basically meaning that the mental health system today hasn't really the current trends or the specific areas of needs that basically lacking for the minority populations in America. And the reasons for this is because these populations are often inadequately served. And there is no integration of respect and understanding of certain traditions, beliefs, and languages of culturally diverse groups. Another sentence reads that while access to mental health services is lacking scarce rural communities, African American rural residents may also be the most likely to confront significant barriers to care and help seeking. So pretty much from that, I'm sorry, I moved a little too fast. There's efforts to services for minority populations. However, there are still significant barriers. As a result, these populations have a disproportionately high burden of disability from mental disorders. Some of these barriers include denial, financial issues, no knowledge of treatment, embarrassment, and hopelessness. So some other notable barriers that I was able to kind of brainstorm is that the mental health disorder symptoms are they may be masked with substance abuse conditions. So basically, these mental issues they become suppressed and are less noticeable when one abuses drugs, alcohol, or medication. So those who suffer from mental health disorders are more likely to experience an alcohol or substance use disorder. So basically, when you're experiencing or going through two different disorders, such as a mental issue or a substance issue, like two at one time, is called a co-occurring disorder. So people receive treatment for one disorder while the other disorder remains untreated. This may occur because both mental and substance use disorders can have biological, psychological, and social components. Another interesting barrier was that there's a heavy reliance on religious communities to deal with mental or emotional issues. So they rely a lot on their higher power in their religion. So some negative impacts of these mental issues, it really depends on a person's beliefs. If a religion advocates hate for non-believers, these negative beliefs would also become a part of essential brain functions. And some people believe that a health condition such as addiction is a punishment from God and that they are less likely to seek treatment. When people believe that God has abandoned them or when they question God's love for them, they tend to experience a greater emotional distress and even face an increased risk of an earlier death. So pretty much in my perspective, growing up in a traditional black church, people are often told to go to church or go to the altar or put it in God's hands. And there's nothing wrong with that. However, it is important to keep in mind that a mental health ailment or any kind of mental health issue should be treated to the same regard as a physical concern. Another barrier was that communities of color frequently seek help in primary care as opposed to their mental health specialty care and often receive mental health care in emergency rooms and in psychiatric hospitals. And what that kind of says in simple terms is that one may not really know to go to a mental health health specialists. Instead, they go to their primary physician and trying to, when they're noticing something isn't right with a friend or family or whoever the person is, they tend to take that person to their primary physician, and then it only ends up to that primary physician diagnosing it as a mental disorder and referring them to a mental specialist. And another barrier is that there's a delay in seeking treatment until symptoms become more severe, which is pretty much self-explanatory. That kind of says that you know it's not until the symptoms are, I guess, more noticeable when they decide to take them to a physician. So another sentence reads that there's a studies of mental health help-seeking behavior among rural families are rare. Even rarer are studies of African Americans living in these areas. So basically, what the article addresses was that there are research methods that were conducted to address perceptions about help seeking for African American adolescents with mental health issues. Another sentence reads that data was obtained from African American mothers in the rural Georgia area to assess their perceptions of the mental health service system, help seeking processes, and service experiences. So the study basically included a quantitative survey that was given to 163 people with qualitative interviews with a subsample of 21. Pretty much some respondents expressed that they had confidence in consulting a mental health specialist and diagnosing their mental health disorder, while others, as expected, preferred to speak with a family member, go to church, or go to school. And this sole dependence on family, church, or school in seeking mental health further supports the barriers that were covered in the previous slide, as well as another result is cultural mistrust, and that's another one of the two most frequently endorsed barriers. So, in conclusion to this abstract summary, um, there's a greater attention to advocacy and public policy at the core of impediments to seeking mental health care, and that should be incorporated to reduce and eliminate barriers to help seeking among rural African American families. So, pretty much, there's warranted efforts that should be at the advocacy of encouragement for rural communities to seek mental health services that satisfy their needs. And that is pretty much it, everyone. Thank you so much for watching. Have a great day.